To my safe practice demonstration video, I'm going to be doing the skill of IV push or direct medication administration for Elizabeth Bennett, who is currently having 5 out of 10 pain, which I know after assessing my patient. So before we start, we're just going to look at the patient care orders and the MAR to see that the doctor has ordered her to have 2 milligrams of morphine IV, PRN for pain, and I'm going to do some hand hygiene. Probably do more later. And I'm going to come over here to the IV monograph, open up to the morphine page, and so I'm going to be looking for any contraindications, cautions, administration directions. So I'm giving via direct IV to an adult. It can be diluted in 5 to 10 mils of normal saline at a maximum rate of 2 milligrams per minute. I'm also looking at what I'm going to be monitoring in my patient, what I'm going to be watching for. There's no reconstitution required for this medication, compatibility, cautions, adverse effects, etc. And then also adverse effects for elderly, which looks like we're okay for this patient. Big safety piece is checking the monograph. So now that that's done, before I start drawing out my medication, I'm going to confirm my math. So I'm giving it in a 10 ml syringe. I'm going to be drawing up 9 mils of normal saline and 1 mil of the med, and in total I'm going to give the patient 2 mils, and I'm going to be wasting 8 mils from the syringe. So I'm going to get my equipment out, got my 10 ml syringe, my blunt filter needle, my label filled out with the medication and the patient information. And I'm going to start with my first check, so making sure that it's not expired. I have my morphine 10 milligrams per mils, doesn't expire until 2035. And I also have my normal saline, which doesn't expire until 2023. And before I sterilize those, actually, I'm going to prep my syringe. No, I didn't. That's okay. Alright. Okay, dokes. And in case I didn't mention, I would have an RN double check my math because I'm still a student. And then I'd also check the, if I remember what it's called, the narcotic drug administration record with the RN. Alrighty, so I did my first check. I'm going to do my 7 rights next. So I have the right patient, Elizabeth Bennett. I have the right drug, which is morphine. I have the right dose, which is 2 milligrams, as I determined with my math, which is going to be given in 2 minutes. The right route is IV. The right time, this is a PRN medication, and I'm currently giving it at 3:30, we'll say. The right reason, as she's having 5 out of 10 pain. And then the right documentation, so after I drop my medication, I'm going to dot my MAR to say that I've prepped it. And I'm also looking to make sure that my MAR is verified with the initials in 2 places, which is all good. So I'm going to first sterilize this with a swab. We'll say that was for 30 seconds. I'm going to aspirate some air into my syringe. And then that air goes into the saline. That was a funny noise. So I'm going to drop my 9 mils of saline next. Put some air in there. Make sure I get the big bubbles out. That's 9 mils. There we go. So I got my 9 mils of saline. Next up, I'm I'm going to prepare my little ampule, so I'm going to clean it and break it. Before I break it, I'm going to do a little swirl, make sure it's all at the bottom. Take it away from me. That's the sharps. And I'm going to drop my 1 ml of morphine. Because I've got a little bit of what's going on here. I don't know how that happened. Oh, but that's 10 mils anyway. Okay. So I have my 10 mils in total. Check with the nurse that I had taken out 1 ml of morphine. And before I go to the bedside, I am going to waste 8 mils. So I'm going to do that into the garbage. And then as I get closer to where I want to be, I'm going to slow down so make sure I'm accurate in what I'm giving. Into 2 mils. 2 mils there. And then if there's any wastage here, I would check this off with an RN and do the appropriate documentation and then put that in the sharps. So I've got my swab. I'm going to pop my label on there, which I've added with the morphine, patient information, the amount, etc. And because I've drawn it up, I can dot my mark. And bring my more over to the bedside. And there we go. So I'm going to enter my patient's room. Hi Elizabeth, can you confirm your first and last name for me? Elizabeth Bennett. I get them to confirm their birth date and their personal health number, and that's right on my MAR. And then asking about allergies, I can see that she's allergic to tetracycline, which we're not using today, so no worries there. I'm gonna raise that up. Got my gloves on after doing hand hygiene. I'm gonna clean the port. That didn't fall. 30 seconds. Now I'm going to make sure that the line is patent. So I'm going to aspirate, see that blood is coming through. I'm going to slowly push to check for resistance. I'm clamping, of course. And then I'm going to instill 2 mils. Fast forward, push, pause, push, pause, push, and clamp. And then her medication. Sterilize that same port. And speeding it up for the video, I would instill it at 2 milligrams over 2 minutes. I'll finish with another flash. This would be a new one. Am I out of time? No? Okay, push, pause, push, pause, push, clamp. I'll annotate it. I'll check on the patient in about 15 minutes, make sure that her IV site is looking good, and document everything out here.